Right now, there is a mask mandate in Guilford County. You're supposed to wear one in all public places. But pretty much everywhere you go, you'll see at least some folks not wearing a mask. I'm Ben Briscoe. From now until 6, we're going to dig into a loophole in the mask mandate that lets that happen and everything you need to know about it. Viewer Lee saw the problem firsthand and emailed us. She said, "My husband and I were in a store this past weekend. The new mask mandate just went into effect. We watched a lady walk into the store and the manager of the store stopped her and reminded her the mask mandate. Her response was, 'I have a mask exemption.' The manager didn't go further. The manager allowed her to go into the store without another question. Can a manager or anyone ask to look at your exemption?" Our conversation between myself and my husband was that it's pretty easy to slide by if you don't have to show this. So how would you know if you're telling the truth or not? Please verify this for us. Now, we went straight to the Guilford County Attorney, the person in charge of writing this mandate. Here's what he had to say. It is true that if someone says they have a medical condition that prevents them from wearing a mask, you cannot ask for proof, etc. You can ask someone if they're not wearing a mask for a medical reason, though. This is not a particularly common situation. All establishments are expected to do what they can to promote compliance. The county attorney is not the only one saying it should be rare for someone to have a medical exemption from the mask mandate. Doctors say there are very few reasons that actually make it medically dangerous for you to wear a mask. WFMY News 2's Lauren Coleman explains.
When it comes to wearing masks, the general public isn't in agreement. Some are all for it, others very against it. And a third group says they can't wear masks. So who exactly can't wear a mask? According to the CDC, it's children younger than 2 years old, anyone who has trouble breathing, anyone who is unconscious, incapacitated, or otherwise unable to remove the cloth face covering without assistance.
So from a medical standpoint, it would be extremely rare to have a condition where you truly could not wear a mask.
Who does that include? Chief Medical Information Officer Dr. Clay Callison from UT Medical Center says inability to wear a mask is rare, but there are exceptions to everything.
If you're really claustrophobic and you feel like that makes you claustrophobic, I get that. And so I think it's about being, as sensible as possible.
He says consult with your doctor and try different kinds of masks because some may work better for you than others.
It really should be combined with other things such as physical distancing and hand hygiene, but masks do definitely play a big role in that.
Lauren Coleman, WFMY News 2.
Again, if you really do medically are not able to wear a mask, we respect that. We want you to have that right. But businesses are not allowed to ask for proof that you actually fall into one of those valid medical reasons. And that's the way it's going to stay for now, because today, Governor Roy Cooper said instead of implementing a statewide mask mandate, he thinks it's better for local governments to come up with their own rules.
I think you get more effective buy-in when it is done at the local level and decisions are being made at the local level, particularly now with all of the knowledge that we have. And I know that Dr. Cohen, Dr. Tilson, a lot of our medical providers have been on the phone with local elections board. They're educating them on this. They're becoming more and more receptive for the need to do this. I think it's a better way to do it right now.
Back when the pandemic started, we wanted to know why masks are so important. They told me the best way to visualize it when I asked the doctors is with spray paint. Take a look. Ben Briscoe here. Researchers say the most likely way you can catch coronavirus is through someone's water droplets that spray out of their mouth when they're talking to you. They are so small that you can't see them, but doctors tell me that spray paint is actually a good representation. So standing about an arm's length away from someone, the average personal space of a bubble in the United States, look at what happens when you're talking to them. They get completely covered in those droplets. Now, doctors tell me each one of these specks could have up to 1 million pieces of the virus inside of it. Now let's use the red spray paint to show you what happens when someone's wearing a mask. When they're talking to you through a mask, it catches all of it almost. Look, there's hardly any red particles on this poster board.
Face coverings that cover your nose and your mouth help because if you have COVID-19, you may not know it yet. You can give it to some other people before you have any symptoms. We all need to take precautions.
But in order for this to work, you've got to wear it correctly.
The face covering needs to go over both your nose and your mouth. And make sure that when you are taking on and off your face covering, you want to do that by the ear coverings here and not touch the front. And when you take it off, washing your hands right away.
Medical researchers at Ohio Health posted a video on YouTube showing what happens when you touch your mask while you're using it and taking it off. The germs even get on your face, and that's how you can get sick. That video really is the poster child for why you should wash your hands often. I'm just gonna come out and say it, because I bet you're probably thinking it too. This stinks. Wearing a mask again is no fun. It's uncomfortable, it itches, it can make your face break out. Look, I'm fully vaccinated, told I was protected. Frankly, I don't want to wear a mask either. But here's why I am. For my mom, who's immune compromised, and my adorable little nephews who are too young to get the vaccine. Many top medical researchers from around the globe have all found the same thing. Even though I'm fully protected from getting really sick, I could still have COVID, not know it, and spread it to them. If anything happened to my family or your family because of me, that would be hard to live with. At first, the science behind masks seemed wishy-washy, but coronavirus was new. Scientists know more now, and they're continuing to learn more too. But it's not just the data. There's actual proof we can see of how well masks stop the spread of those water droplets which can carry coronavirus. At this point, the Centers for Disease Control and the World Health Organization both recommend wearing a mask. So do people we trust right here in the Triad, our local doctors.
You're going to want to wear your mask, particularly indoors, or we're doing things like going to the fitness center, going to places where there's a lot of other people.
It's definitely protecting them from COVID. It's also protecting them from other viruses.
And when I really get frustrated about wearing a mask, which happens more often than I would like to admit, I think about how awful it was when everything was shut down. We couldn't go anywhere, and so many of our neighbors were out of work, including my fiance. The CDC says all of those shutdowns could be needed again if the virus continues to spread like wildfire and mutates more.
The largest concern that I think we in public health and science are worried about is that virus and the potential mutations away we are from a very transmissible virus that has the potential to evade our vaccines.
At the end of the day, wearing a mask is a lot like wearing a seatbelt. That always itches too, and it's uncomfortable, but it's an important layer of protection when we're out and about. That's my 2 cents. I'd love to hear yours. If you still have concerns about wearing a mask, let's talk about it together. Just message me on Facebook by searching for Watchdog Ben.